When most people think about managing diabetes, they focus on cutting back on carbs, taking medication, and watching their blood sugar levels. While these are important, there's one key factor that's often overlooked: nutrients. The right vitamins and minerals help insulin work properly, protect your nerves, and prevent serious complications. Many diabetics are unknowingly low on these essential nutrients, which affects blood sugar control, energy, and overall health. If you often feel tired, experience body aches, or struggle with unstable blood sugar, correcting these deficiencies could really improve your well-being. Below are the top 3 vitamins that are especially important for people with diabetes. Vitamin D. Vitamin D is more important than you might realize. It isn't just for strong bones or a healthy immune system. It also helps insulin work better, reduces inflammation, protects your nerves, and supports your organs. People with diabetes are at a higher risk of vitamin D deficiency because insulin resistance and chronic inflammation make it harder for the body to process vitamin D. High blood sugar and frequent urination can flush vitamin D out before your body uses it, and spending less time outdoors means you get less sun exposure, which is how we naturally produce vitamin D. As we age, our pancreas and liver struggle more to activate vitamin D, so even if you get some, your body might not use it well. A simple blood test can check your vitamin D levels, and there are many signs to watch for when levels are low. These include constant fatigue, muscle weakness, bone pain, slow wound healing, numbness, frequent infections, and brain fog. Some people also notice sugar cravings, mood swings, or unexplained inflammation. Low vitamin D affects every major system in the body. In men, it can lower testosterone and sperm quality. In women, it can disrupt ovulation and estrogen balance, making conception more difficult. It can also lower libido, worsen nerve pain and neuropathy, increase the risk of kidney stones and chronic kidney disease, and contribute to diabetic eye problems by damaging the small blood vessels in the retina. Moreover, low vitamin D is linked to high blood pressure, arterial stiffness, and plaque buildup, which raise the risk of heart attacks and strokes. On a cellular level, vitamin D improves insulin sensitivity by helping pancreatic cells produce and release insulin, while also reducing chronic inflammation and helping regulate calcium transport for proper nerve signals, muscle contractions, and blood sugar control. To naturally boost vitamin D, choose foods like cod liver oil. Just 1 tablespoon can deliver 340% of your daily needs. Wild-caught salmon, about 130% per 100 grams. Sardines, with bones, around 110% per 100 grams. Egg yolks. 2 large eggs provide about 20%. Sun-exposed mushrooms, approximately 40% per 100 grams if grown under UV light. For a gourmet option, consider meals such as glazed salmon, pan-seared cod liver with garlic butter, or scrambled eggs with shiitake mushrooms. If food isn't enough, supplements can help, but choose carefully. Options like vitamin D3 supplements, ranging from 1,000 to 5,000 IU, or formulas that include vitamin K2 can be especially effective, as vitamin K2 helps ensure calcium is absorbed properly. Also, keep in mind that some foods can block vitamin D absorption. Processed vegetable oils, like soybean and sunflower oil, sugary foods, refined carbs, which deplete magnesium needed for activating vitamin D, excessive alcohol, and high fiber. Grains like whole wheat and brown rice can all interfere with vitamin D uptake. Fixing a vitamin D deficiency isn't just about taking a supplement. It's about combining good sun exposure, the right foods, and proper absorption. Vitamin B9, folate. Folate, or vitamin B9, is vital to your health. Unlike fat-soluble vitamins that the body can store, folate is water-soluble, so you need to replenish it every day through food or supplements. Diabetes makes it harder for your body to absorb and use folate. High blood sugar leads to inflammation and oxidative stress, which interferes with folate metabolism. Additionally, the diabetes medication metformin can block folate absorption, and frequent urination can flush folate out before your body has a chance to use it. Folate deficiency can be tricky because its symptoms, like fatigue, muscle weakness, and slow-healing wounds, are often mistaken for normal diabetes-related issues. You might also experience brain fog, forgetfulness, or difficulty concentrating. Over time, not having enough folate can lead to anemia, causing pale skin, dizziness, and shortness of breath. Folate is essential for DNA synthesis and cell repair. Without enough folate, your body's ability to regenerate cells slows down, leading to increased oxidative stress and inflammation. This deficiency affects nearly every system in your body. For men, low folate can damage sperm DNA, reducing mobility and fertility. For women, folate is important for egg quality and hormone balance, and low levels can raise the risk of miscarriage and pregnancy complications. Folate also supports sexual health by helping with blood flow and nitric oxide production, both critical for libido. It plays a key role in producing neurotransmitters in the nervous system. So without enough folate, you might experience nerve pain, neuropathy, depression, or memory loss. Additionally, folate helps regulate homocysteine, an amino acid that, when elevated, can harm kidney function and damage your arteries, increasing the risk of heart attacks and strokes. You can get plenty of folate from foods such as beef, liver. Provides about 140% of your daily needs per 100 grams. Cooked spinach, around 65%. Cooked lentils, approximately 90%. Cooked asparagus, about 35%. Avocado, medium, roughly 25%. For a gourmet twist, consider dishes like duck liver pâté, truffle-infused risotto with asparagus and spinach, or miso-marinated black cod with avocado puree. If food alone isn't enough, supplements can help. But it's best to choose methyl folate, the active form, because it's more easily absorbed by your body. High-quality supplements from trusted brands can ensure you get the right amount. Also, try to avoid processed grains, like white rice, white bread, and pasta. Excessive alcohol and high-sugar diets, as these can reduce folate absorption. Certain medications, including metformin and antacids, can also block folate uptake. Vitamin B12. Many diabetics are at risk for vitamin B12 deficiency, especially if they take metformin. Over time, metformin can lower your B12 levels, and high blood sugar itself can harm your stomach lining, making it harder for your body to absorb B12. As you age, your stomach naturally produces less acid, which is needed to extract B12 from food. B12 deficiency develops slowly, and its early signs are often mistaken for normal aging or other diabetes complications. Watch for symptoms such as tingling, numbness, or a burning sensation in your hands and feet, chronic fatigue, dizziness, shortness of breath, memory problems, or brain fog. In men, low B12 can reduce sperm quality and testosterone levels, while in women, it may disrupt ovulation and increase the risk of miscarriage. Without enough B12, your nerves can deteriorate, worsening diabetic neuropathy, and high homocysteine levels from a deficiency can damage your kidneys, affect your vision, and raise your risk of heart problems like blood clots, high blood pressure, heart attacks, and strokes. Vitamin B12 is essential for energy production, DNA synthesis, and nerve regeneration. One of its most important roles is converting homocysteine into methionine, which helps reduce inflammation and protect your arteries. For people with diabetes, B12 supports nerve repair, reduces fatigue, and enhances cognitive function. The best sources of B12 are animal-based, foods because plants don't naturally contain this vitamin. For example, beef liver, a powerhouse that delivers over 3,500% of your daily needs in one serving. Clams provide around 4,000%. Sardines, about 350% per 100 grams. Salmon, approximately 200% per 100 grams. Eggs, 2 large eggs contribute around 25%. For a gourmet option, dishes like French-style meats with truffle sauce, Japanese sea urchin sashimi, or lobster thermidor are very rich in B12. If you don't enjoy these foods, supplements such as methyl B12 that dissolve under your tongue can be a great alternative, as they bypass digestive absorption issues. However, some habits can still lower your B12 levels. Excessive alcohol can damage your stomach lining, making it harder to absorb B12. Processed grains like white bread and pasta lack nutrients and can cause inflammation that further hinders B12 absorption. Acid-reducing medications, like proton pump inhibitors, lower stomach acid, which is necessary for extracting B12 from food. And diets high in refined sugars and processed foods can also interfere with maintaining proper B12 levels. If you're feeling constantly tired, forgetful, or notice tingling in your hands and feet, it might be time to have your vitamin levels checked. By including vitamin-rich foods in your diet and considering high-quality supplements when needed, you can support your nerves, heart, brain, and overall energy levels. Focusing on vitamin D, folate, B9, and vitamin B12 can make a big difference in managing diabetes and improving your health. Take control of your health today. Small changes can lead to big improvements over time. Stay healthy.